Come in.
Hi, Mr. Yao.
Hey.
Hello, my name is Jack Merton. I'm a second year medical student here at UMS. I'm gonna wash my hands first.
Okay.
So I'm gonna be doing a physical exam on you today, if that's okay.
Sure.
All right, so I'm gonna start with your upper extremities.
Okay.
So the first thing I'm doing is just checking, looking and see if I see any obvious swelling or abnormalities or any signs of infection. You look very symmetrical to me. Those shoulders look normal, neck is midline. I'm gonna look at the back. I can see your scapula looks good. Okay, great. So now I'm going to palpate a little bit. That's okay.
Sure.
You feel a little bit here, and let me know if you feel any tenderness or anything.
Okay.
So I'm gonna start with your sternoclavicular muscle, and that feels good. Now I'm going to move on to your acro midclavicular. Good there. And now your glenohumeral. Does that feel okay?
Yep.
Okay, now I'm going to look at your biceps tendon. So I'm going to start with your bicep and follow it up. Okay, that feels good to me. Okay, so now I'm gonna have you do some motions for me. If you can lift your elbow up all the way, adduct it, abduct it, and adduct it back down. Great. And if you can internally rotate for me, good. Now externally, great. And if you can flex it, and then extend it back.
You may like this.
Flex it like that.
Yeah,
Yes.
sorry.
You're good. Good. How did that feel? Okay.
Yeah, fine.
Good. Okay, so now I'm going to move on to your elbow. So first, same thing, I'm inspecting for any swelling, any abnormalities or signs of infection. All looks good to me. I'm going to first look at your antepopliteal fossa. Antecubital fossa looks good. Your medial and lateral epicondyles. Medial looks good. Lateral looks good. And now the olecranon looks good. Okay, now I'm just gonna palpate those same things. Antecubital fossa, medial epicondyle, lateral epicondyle, olecranon. Does that feel okay?
Mm-hmm.
Okay, so, oh, and also your radio capitellate joint. Okay, looks good. And now if you can flex your elbow for me, extend, now protonate, and supinate. Okay, good, did that feel okay?
Mm-hmm.
Okay. So now I'm gonna move on to your wrist. Looks good there. I'm looking at, again, for any abnormalities or swelling or signs of infection. I don't see any there. Do you have any pain or weakness with your wrist?
Nope.
Okay. So now I'm gonna look at your, I'm gonna go ahead and palpate your metacarpal bones and your wrist. Does that feel okay?
Mm-hmm.
Okay, and now I'm gonna move on to your MCP joint. Is that okay?
Mm-hmm.
And now your phalanges. Don't feel anything abnormal. Okay, so now if you could flex your wrist for me.
Mm-hmm.
Okay, now extend. And with your hand out straight, turn it to your left side for your ulnar, and then to your right, ulnar deviation, the other, there you go, that's radial deviation, looks good there. So now if you can go back to midline and abduct your fingers. Okay, good. And then adduct them back, and if you could flex and extend. And now bring your thumb in and form a fist. Okay, good. Extend back out And I'm just going to check your opposition. If you could tap your fingers to your thumb. Okay, I think that looks good. So now I'm going to move on to your lower half. Okay, so now if you could stand up for me, I'm going to move on to looking at your knees first. Okay, so could I lift your pant up a little bit? Okay. Great, so I don't see any swelling or abnormalities, any other signs of infection. Looks symmetrical to me. I don't see any varus or valgus deformities. If you could step forward a little bit for me. I'm gonna look at the back of your knees. Looks good there. Okay, you can turn back around. Okay. And now if you could sit back down for me. I'm going to start with palpating your quadriceps tendon. So if I can start here, just feel as it goes down to your knee. Does that feel okay?
Mm-hmm.
All right. And now I'm feeling your patella. Does that feel okay?
Mm-hmm.
Patella tendon. Now your lateral epicondyle, medial epicondyle. Okay, and now I'm gonna look at your popliteal fossa. Can you feel that?
Yep.
Okay, that seems good. Okay, so now if you could lay down for me.
Okay.
I'm going to perform a biometrin test. This is just checking to see if there's any fluid in the bursa of your knee.
Okay.
So just feel that there. Okay, I don't see any fluid rebounds, so there's no excess fluid. Okay, you can sit back up for me. Okay, so now if you can flex, or you can lay back down actually. If you could bring your heel kind of up to your hip, flex. Okay, so flexion looks good, and now if you could extend it back down. Okay, extension looks good too. Okay, so if you could stand back up for me now, I'm going to move on to your ankles. Okay, so I'm just examining again for any swelling or signs of infection. Looks good to me. I'm examining your arches, which look normal. Calcaneal alignment looks good. Okay, now your big toe. Everything looks good. Any trouble here?
Nope.
Okay. If you could sit back down for me now, I'm gonna look at the soles of your feet. Okay, looks good there. Okay. So, in the sitting position, I'm gonna check your palpate just your anterior ankle joint there. Now your lateral malleus. Medial, does that feel okay?
Mm-hmm.
At the base of the first toe, fifth toe, does that feel okay?
Mm-hmm.
Medial arch, that's good. Now distal Achilles tendon, does that feel okay?
Mm-hmm.
Okay, and now if you could stand back up for me, or actually, I'm sorry, let me sit back down. And just invert your ankle and then evert it. Okay, that looks good. And then if you could point your toe, plantar flex, and then dorsiflex. Okay, looks good. Okay. Okay, so now I'm gonna move on to your spine. I'm gonna look back here and just check again for any swelling or asymmetry, any signs of infection. All looks good. Posterior looks midline. Okay. Now I'm going to palpate your sphenius process. Good. Now your paraspinal and trapezius muscle. Does that feel okay?
Mm-hmm.
Okay, so now if you could bring your chin to your chest, check flexion, and then extend it back for me for extension. Okay, good. And then ear to each side. Now to your right. Okay, and then if you could turn your head to the left and to the right. Okay, looks good there. So now I'm gonna have you stand up so I can inspect your lumbar spine. If you could turn around for me. So I'm just checking again. Symmetry looks good. I don't see any obvious swelling. Your spine looks midline to me. If you could bend over and touch your toes for me, I'm gonna check for scoliosis. I don't see any there. Spine is very midline. Good. Okay, now I'm gonna just palpate your midline. Seems good. And now your paraspinal muscles. And now your SI joint. Feels good there. Okay, so now if you could just bend over for me. Flexion there. Does that feel okay?
Mm-hmm.
And now if you could stand up all the way, I'll wash your head there. And kind of just maybe as much as you can back. Okay, good. And then lean to your left side. And then your right side. And then rotation. Okay, how did that feel?
Good.
Okay, you can go ahead and sit back down for me. That concludes my physical exam. Do you have any questions about anything?
No.
Okay, well, I'm going to take a step out. I'll be back in a second to check on you.
Thank you.
Mm-hmm.